Endocrine drugs. Insulin, pancreatic hormone that increases activity plus production of glucose transporter, helps move glucose into cells and out of blood, promotes storage of carbs, lipids and proteins. Insulin decreases blood glucose levels. Glucagon promotes conversion of stored carbs, lipids and proteins into glucose and releases glucose into blood. Glucagon increases blood glucose levels. Type 1 diabetes mellitus. Due to genetic, immunologic factors. Adequate amounts of insulin are not produced. Equal patient requires insulin injections on a daily basis. SS, polyuria, polydipsia, polyphagia, hyperglycemia, glycosuria. Type 2 diabetes mellitus. Onset is usually during middle age. Insulin is produced but not enough to compensate for hyperglycemia. Treatment equal diet, exercise, oral hypoglycemics, insulin. Antidiabetic drugs plus glucagon. Insulin. Used for type 1 diabetics, adjunct treatment for type 2 diabetics, and for diabetic ketoacidosis. For types of insulin, rapid-acting, Lispro, short-acting, regular insulin, intermediate-acting, NPH, long-acting, Glargine. Excess of hypoglycemia, cold, clammy, irritable, pale, weak, diaphoretic. Excess of hyperglycemia, polyphagia, polyuria, polydipsia, blood vision, fruity breath, hot plus dry. Side effects: hypoglycemia, Somogyi effect, hypoglycemia followed by rebound hyperglycemia, lipodystrophy, disturbance in fat deposition, and insulin resistance. When mixing regular insulin with NPH, always draw up regular insulin, clear, into the syringe first. Treat hypoglycemia with oral glucose tablets, glucagon, or 4-glucose.
Oral antidiabetic drugs. Used for type 2 diabetics. MOA stimulates insulin release from beta cells in pancreas and reduces glucose output by liver. Side effects: hypoglycemia is the main side effect. Patient may need insulin during times of bodily stress, infection, fever, surgery, trauma. Metformin, acarbose, miglitol, and thiazolidinedions don't cause hypoglycemia when taken alone but may increase the hypoglycemic effect of other hypoglycemic agents. Glucagon. A hormone normally produced by alpha cells in the pancreas. This drug raises blood glucose levels. Used for emergency treatment of severe hypoglycemia. MOA promotes glycogenolysis, conversion of glycogen into glucose, gluconeogenesis, formation of glucose from fatty acids plus protein, and lipolysis, the release of fatty acids to be converted into glucose. Side effects: rarely any. Thyroid drugs. Used to treat hypothyroidism. These drugs contain triiodothyronine, T3, thyroxine, T4, or both. MOA stimulates metabolism of all body tissue by accelerating rate of cellular oxidation. Thyroid stimulates protein synthesis, gluconeogenesis, and increases glycogen storage. Levothyroxine is the drug of choice. Side effects: diarrhea, abdo-cramps, weight loss, palpitations, headache, tremor, heat intolerance. Thyroid antagonist. Used to treat hyperthyroidism. MOA blocks iodine's ability to combine with tyrosine prevents thyroid synthesis. Side effects: granulocytopenia.
Mental health drugs. Antidepressant drugs. SS of depression, sleep disturbances, extreme fatigue, abnormal eating patterns, vague physical symptoms, inability to focus attention, death obsessed, avoiding personal interactions, lack of interest in sex, personal appearance, delusions, hallucinations. SSRI. Used to treat major depression, panic disorders, eating disorders, personality disorders, and anxiety. Drug of choice for depression. MOA, drug inhibits neuronal reuptake of serotonin equal increase in serotonin levels. Abrupt discontinuation can lead to SSRI discontinuation syndrome, SS, lowered mood, lethargy, irritability, paresthesia. Side effects: anxiety, insomnia, somnolence, palpitations, sexual dysfunction, orthostatic hypotension, increased suicidal ideation. Drug needs to be taken for 2 to 4 weeks for relief of symptoms to be seen. Monoamine oxidase inhibitors. Used to treat depression, panic disorder, eating disorder, post-traumatic stress disorder. Used when a patient does not respond to SSRI or TCA. MOA inhibits monoamine oxidase, normally metabolizes neurotransmitters like serotonin and norepinephrine, increases the amount of neurotransmitters, serotonin, dopamine, norepinephrine. MAOI taken with amphetamines, methylphenidate, levodopa, or sympathomimetics may increase catecholamine release causes hypertensive crisis. Stop an MAOI 2 weeks before starting another antidepressant. Avoid foods high in tyramine, aged cheese, red wine, beer, avocado, chocolate, and caffeine can lead to hypertensive crisis. Side effects: hypertensive crisis, orthostatic hypotension, restlessness, drowsiness, dizziness, headache, dry mouth, blurred vision, urine retention. Tricyclic antidepressants, TCAs. Used to treat major depression. Second choice of drug after SSRI. MOA inhibits reuptake of NE and serotonin, but not dopamine, also blocks acetylcholine and histamine receptors. Side effects: orthostatic hypotension, cardiac dysrhythmias, anticholinergic effects, dry mouth, blurred vision, tachycardia, restlessness, sedation, weight gain, respiratory depression.